Breathing circuits. The breathing circuit connects the anaesthetic machine to the patient. There are two types you should know about. Our anaesthetic rooms have Bain circuits, also known as Mapleson D circuits. These are relatively high flow circuits, 6 to 8 litres a minute fresh gas flow or more is needed to run them optimally. The anaesthetic machines in theatres have circle systems. These recycle expired gases by passing them through a carbon dioxide absorber, so very low fresh gas flows can be used for long cases as little as 0.3 litres per minute. This makes circle systems very cost effective. A very brief description of the Mapleson classification of anaesthetic breathing circuits. We only use the Mapleson D or Bain system at the RAH, but there are 5 circuits described, from A to F, F being a modified E, so there are actually 6, and they're categorised by the flow needed to prevent carbon dioxide rebreathing, which was important in the days before we had CO2 monitors. Please note that the circle system is not included in the Mapleson classification. If you want to delve into the systems other than the Mapleson D, please use the YouTube link on the slide and in the description. The Bain circuit has a coaxial system, which means it has 2 tubes which conduct gas. There's an inner narrow black rubber tube which delivers fresh gas flow, and there's a wide opaque corrugated outer tube which takes expired gas back to the reservoir bag. The APL valve is close to the reservoir bag and the anaesthetic machine, leaving the patient end of the circuit nice and light. The fresh gas flow needed to prevent CO2 rebreathing depends on whether the patient is breathing spontaneously or whether there's controlled ventilation. Breathing spontaneously, you need a fresh gas flow of 200 to 300 mils per kilo. So for a 60 kilo person, that would be 12 to 18 litres a minute, quite high. For controlled ventilation, only 70 mils per kilo fresh gas flow is needed, so 4.2 litres a minute for someone who's 60 kg. In practice, you would normally set the gas flow to around 6 to 8 litres per minute, and you can monitor whether there's any CO2 rebreathing on the capnograph. On to the circle system. Key to the operation of the circle system are 2 one-way valves within the circle. There's one in the inspiratory limb and one in the expiratory limb. The inspiratory valve opens when the patient breathes in and shuts when they breathe out. The reverse happens with the expiratory valve. This means that the patient doesn't breathe in any expired gas containing CO2, and also that no expired gases contaminate the inspiratory limb of the circuit. Expired gases are passed through a carbon dioxide absorber, also known as a soda lime absorber. CO2 is removed by the absorber, and the remaining gases, oxygen, nitrogen, volatile agent, nitrous oxide if you're using it, are passed back into the inspiratory limb and thus recycled. I've got a diagram and a picture of the one-way valves on this slide. You can see how they operate from the diagram. They're just a simple disc sitting on top of a cage, which will open or close depending on the direction of gas flow. The carbon dioxide absorber lies within the expiratory limb of the circuit. Carbon dioxide in the expired gases is removed by a chemical reaction with the absorber granules. There's a colour change in the granules as the chemical reaction takes place, so you can see when the active ingredient is exhausted and you need to change the canister. Once the carbon dioxide is removed, the expired gases minus the CO2 are recycled into the inspiritory. So the recycled gases are oxygen, nitrogen, volatile agent, nitrous if it's being used, and also warmth and moisture. The recycling of warmth and moisture prevents desiccation of the respiratory tract and adverse effects on mucociliary function. What is in the soda lime granules? The main components are calcium oxide 70%, water 20%, sodium hydroxide 3%, and potassium hydroxide 1%. There's a series of reactions, but the overall reaction is carbon dioxide combines with calcium oxide to form calcium carbonate and heat, and this takes place in the presence of water. You can see a complete breakdown of all the reactions at the end of the presentation. Pros and cons of the circle system. The advantages are it's very economical in terms of volatile and other gas use, and it does warm and humidify inspired gases. On the other hand, it is a complicated system. Cost advantages are offset a bit by the fact that you need to change the soda lime granules quite often. The lower the flow, the more quickly the granules get exhausted. Also, if you change the volatile agent concentration on the vaporizer when you're running the system at very low flow, it takes a long time for this to be reflected throughout the circuit, and you should be aware of that. A few words on the adjustable pressure limiting valve, the APL valve, also known as the spill valve or just the valve. This is a simple device that allows you to increase or decrease the pressure within the breathing circuit. If a patient is breathing spontaneously, we would normally have the valve fully open so there's minimal resistance to expiration. To allow ventilation or bagging of the patient, you need to increase the circuit pressure to a level that you're happy with, usually kind of 20 centimeters of water or so. You should note that when the valve is fully closed, you can generate very high pressures, 60 or 70 centimeters of water, which if transmitted to the patient's lungs can be very damaging, causing pneumothorax. If you do any DIY, you'll know the phrase righty-tighty, lefty-loosey, and that applies to this valve. If you want to increase the pressure, righty-tighty, turn it to the right or clockwise. If you want to decrease pressure, lefty-loosey, turn it anti-clockwise. You can see from the diagram at the bottom of the slide that it's very simple. It's just a spring pushing down on a disc, and the harder you tighten the spring, the more difficult it is for the disc to be pushed up and allow gas to escape. As promised, this is the full soda lime reaction for you to look at your leisure.